Alright, let's dive into something that's been on my mind lately: wildfire smoke. And no, I'm not just talking about the orange skies, or the smell of burning wood. I'm talking about the deadly health burden this stuff carries. Here's the thing: wildfires themselves are terrifying, but what's truly alarming is the smoke. It's not just a nuisance, it's a silent killer. And what's wild is that it doesn't even need to be close to you to cause harm. Let me explain. Imagine this: you're in Toronto, 1,000 kilometers away from the wildfires raging in northern Ontario. You step outside, and the sky is this eerie orange. It's like something out of a post-apocalyptic movie. But here's where it gets personal. Erin O'Connor, who runs an emergency department, noticed a spike in patients with allergies and shortness of breath. And it's not just her. Studies show that wildfire smoke kills 1.5 million people annually, more than floods, flames, storms, and heat combined. Let that sink in. What makes this really interesting is that the smoke doesn't just affect your lungs. It's loaded with tiny particles that enter your bloodstream and hit every organ in your body. It's like a slow-motion disaster. Now, here's the part that blows my mind. The smoke from Canada's 2023 wildfires caused 82,000 early deaths, and a third of that burden landed in the US. Think about that. Winds don't care about borders. What's happening in one country can literally kill people in another. And it's not just North America. About 10% of the UK's fine particulate pollution comes from fires abroad. This isn't a local problem, it's a global one. But here's the kicker: scientists are still trying to figure out exactly how bad it is. We know it's devastating, but the full picture still emerging. What many people don't realize is that the impact of wildfire smoke depends as much on the wind as it does on the fire itself. Take Europe, for example. France and Spain had massive wildfires, but the smoke mostly blew away from populated areas. North America wasn't so lucky. In July, 36 million people across the continent were breathing air deemed very unhealthy. In Duluth, Minnesota, the air quality was so bad it felt like working in a war zone. People were attaching furnace filters to box fans just to survive. And this isn't a one-off event, it's becoming the new normal. Personally, I think what's most chilling is how climate change is amplifying this. Hotter temperatures mean drier vegetation, which means more intense fires. And those fires release particles that are up to 10 times more harmful than regular pollution. It's like comparing a single drink to a year-long binge. Your body just can't handle it. And here's the cruel irony: the very measures we take to protect ourselves from smoke, like staying indoors with windows closed, can make us vulnerable to heat waves. It's a lose-lose situation. But here's the bigger question: can we stop this? Politicians like Donald Trump blame poor forest management, but scientists say it's mostly about rising temperatures caused by fossil fuels. In Europe, rural areas are becoming overgrown, making fires spread faster. Spanish scientists warn we've entered an era of fires we can't extinguish. And with El Niño on the horizon, things are only going to get worse. This isn't just an environmental issue, it's a humanitarian crisis. What this really suggests is that we're all connected in ways we don't fully understand. Jay Jorn and Dan McClelland, the couple in Duluth, said the experience opened their eyes to what people in other parts of the world have been dealing with for years. Climate disasters don't discriminate. And that's the takeaway here: this isn't someone else's problem. It's ours. So, what are we going to do about it? That's the question I'm left with. And honestly, I don't have the answer. But I do know we need to start talking about it before the next orange sky rolls in.